Hello, greetings, everybody. My name is James. I am from the internet, and today we are going to be talking about the greatest healthcare system in the world. Now, for as long as I can remember, people have been telling me that I should be extremely grateful that I was born here in the US of A because we have the greatest healthcare system in the universe. Our healthcare system has been developed and driven by trillions of dollars of investment into advanced robotics, medicines, genetics, and building state-of-the-art healthcare facilities from sea to shining sea. I was brought up to believe no matter where I was in this country, if something bad happened to me, all we'd have to do is dial 3 little numbers on a telephone, and the next thing you know, an ambulance is there, and you are being whisked off to some of the greatest medical care in the universe, and everything was going to be okay. And so, this story has stood for as long as I have been hearing stories. Yet, it turns out that after 2 years of a pandemic, there are very large cracks appearing in the facade of the tale of bullshit that we have been told about the greatest healthcare system in the world. And now it turns out that this industry is just like every other industry in the United States of America. It is solely driven and carried on the backs of individuals who care a lot and make far too little. And unfortunately, as in a lot of other industries, there just aren't enough of those people to go around anymore. So what I thought we would do is take a look at the plight of U.S. healthcare and the workers who keep what's left of it running. Buckle up, everybody, because if this one doesn't make you sad, it's surely going to make you pissed off. Here we go! U.S. hospitals struggle to match Walmart pay as staff flees Omicron. Now, turns out that over the last 2 years, while people have been demanding better in retail and fast food, and white-collar people all over the country have been screaming that they can't get their McMuffins and their Mocha Dusha Frappuccinos in under 15 minutes. All of these employers have been forced to steadily raise the hourly rate just to get people to come in the door and put on a polyester uniform, a hat, and a name tag. However, it would seem that that slow upward mobility that we've been seeing for the people at the very bottom of the U.S. pay scale, that has not been matched at other tiers of our economy. And so now what you're seeing is that people who used to make $8 an hour are making $14 an hour. But the people who were making $14 an hour before this all started, yeah, they're still getting paid the same amount, and it turns out a lot of them work in the medical industry, which I've been led to believe is kind of important, you know, in the middle of a pandemic where we're pushing close to 1 million deaths across the country. But no, it would seem that's really not a concern. So I wonder who's getting all the money in the medical industry, since obviously it's not going to the people who actually form what was formerly known as the greatest healthcare system in the world. Let's find out. U.S. hospitals are struggling to get the workers they need to treat patients through the winter's COVID-19 surge as the virus collides with a historically tight labor market. High demand for labor throughout the economy is making it harder to find replacements for doctors, nurses, and support staff who've been sidelined by the Omicron variant. It's especially tough in small towns and rural areas with aging populations and fewer people entering the workforce. Finding sufficient staff is a daily challenge that industry veterans say is harder than any time they can remember. Job openings in healthcare and social assistance are more than double their pandemic lows, and a record number of people are quitting. Now, this should come as a surprise to literally nobody. People who have been working in medical facilities and hospitals for the last 2 years are totally burnt the fuck out. Why? Because every single time they get a handle on the number of people in the hospital, boom, we get another spread, we get another outbreak, we get another rash of 97% of people in a hospital being those who are unvaccinated. And it's driving all of these people to the brink. And to top it all off, they are making less than next to nothing. The workforce squeeze is upending every aspect of care. A Fort Lauderdale, Florida hospital temporarily closed its labor and delivery unit due to staff shortages. The chief executive of a 25-bed facility in rural Nebraska monitored patients on the floor himself on Monday. In Indiana, where the National Guard was called in to reinforce hospital staff, administrators offered double pay to workers to extend their shifts when colleagues are sick. Quote, "We've had more staff out because they've tested positive and have contracted COVID than we did at the very beginning." Now, here's the part where I remind you that we've seen this. This is a reoccurring theme that even happened in the non-medical industry all last year during the labor strikes, which is you wait until people get to work, and then when their shift is going to leave, you go, "Oh, we'll offer you a ton more money to stay on shift because we don't have enough people," yet facilities can't offer a high enough starting salary when they're advertising to fill the positions to get people through the door to actually come in, put on the scrubs, and take the job. I wonder why that is, that we can afford to literally pay people thousands of dollars of overtime to work at medical facilities, but we can't afford to pay new hires a good enough rate to actually have new hires. Long before the arrival of COVID, doctors and nurses were in high demand. The pandemic has only made that shortage worse as some healthcare workers, depleted by 2 years fighting COVID, opt for early retirement. Others are trading permanent positions for lucrative short-term travel assignments at premium pay, driving up labor costs. 3 out of 4 healthcare facilities were looking for temporary allied health professionals, a category that includes clinical workers who aren't doctors, nurses, or advanced practitioners. So what they're saying is, as an industry, the salaries and the pay hasn't been good enough to retain employees who are finding out that there are higher paying gigs out there that can use their skill set. And so they go and they work for private staffing companies or private hospitals, or they even go into private home health care for wealthy people. In other words, the people who manage to find a financial lifeline escape, and those who don't get stuck here in the grind, making not nearly enough money until burnout literally forces them out the door. The state of Nebraska has the lowest unemployment rate of any U.S. state at only 1.8%. And in that environment, lots of employers still struggle to find workers. But the stakes in healthcare are higher, especially in the COVID era. Tony Bruntz runs Community Hospital, a 25-bed critical access facility in McCook, Nebraska. He's been trying to recruit an ultrasound technician for at least 6 months without even getting a single application. For lower-level positions, the hospital competes with the local Walmart store, where wages are finally starting to go up. He monitors the pay offered by the retailer as well as other large local employers, a hose manufacturer, and an irrigation equipment supplier. Quote, "What used to be an $8 an hour job is now $15 an hour," said Bruntz, a 52-year-old who once worked as an accountant. "That's the only way we get people to come to work." Now, to be fair here, if you had a choice between working the overnight shift at Walmart stocking shelves where there's almost nobody around and you can get $14, $16, $18 an hour, or working at a hospital that's crammed to the gills with people during a fucking pandemic for the same amount of money, which one would you choose? No, don't feel guilty about taking option A. I'm pretty sure that's literally what most people are doing, which is why this guy can't get employees in a healthcare facility during the middle of a pandemic. He sees a long-term dilemma that will persist beyond COVID waves, particularly in rural areas with aging populations. Quote, "We're going to have so many more people retiring than entering the workforce that this is just going to get worse." Across the state in Columbus, Nebraska, Mike Hansen, a chief executive of Columbus Community Hospital, said hourly entry-level wages have been going up for 2 years and are now in the $15 to $18 an hour range. Nursing wages have increased by $4 to $6 per hour in just the last year to start at $35 to $40 an hour and rising with experience. Now, that is not bad in this day and age. However, this comes with the caveat that to be a nurse, one must go to nursing school. And to go to nursing school, one must be able to afford secondary education past high school. And of course, all of the people who would have gone to nursing school, well, they've been working at McDonald's and Walmart, and they've been making $7, $8, $9 an hour for years. And it's kind of tough to save up money to go to nursing school when you make next to nothing, and what little you make goes to pay rising rental costs. And so it would seem that there is a bill there that is finally coming to be paid. Now, there is one more piece of this that we need to discuss. A few years ago, when the pandemic first hit, the plight of retail workers and fast food workers was very simple to see, and it was easy to point out and go, look, these people are making next to nothing, yet the corporations behind them are making billions of dollars. And the pile of dead bodies, the lack of employees, and the overall shaming of these corporations has led them to shave a little bit off their record profits to slowly raise the wages of all these people. But a lot of these medical people, nurses, medical staff, these people work for hospitals that turn almost no profit or even operate in the red. Yet, seemingly hospitals are full all the time and there's money going in, but there's no money coming back out with the employees as they leave after their 36-hour shift. So the question becomes, where's all the money? Oh, that's right. It's with all the health insurance companies. Now, I know we're in 2022, but we've yet to get the full accounting for 2021 for a lot of these companies. However, it seems even halfway or 2/3 of the way through 2021 by digging through news archives that all of these insurance companies are making record revenues, record profits, and are giving out record shareholder dividend checks. For example, Cigna Health in the third quarter of 2021 did $44.3 billion in revenue, with shareholders getting $1.6 billion of that. Not the nurses or the lab techs or the employees at hospitals. No. They weren't getting all the money. Cigna and their shareholders were. Oh, yeah, this is all starting to make sense now. Meanwhile, Cigna Health's running buddy, Anthem Health, yeah, they did over $2 billion of profits just in the third quarter of 2021, which was an increase of more than 900% from the same quarter a year ago. So what does all this mean for you, the average viewer at home, the fellow member of the working class? Well, number one, it means, God forbid, you have to go to a hospital, your waits are going to be longer than ever, and the risk to you is going to be higher than ever. And it is absolutely zero fault of the people who work at the hospital, the few remaining folks who seem to care so goddamn much that they're willing to go to work every day and risk contracting COVID just because their calling is to help people. And how do we repay them? Well, we let industries run roughshod over their facilities to the point where they make next to nothing and have to work in antiquated settings. And nobody seems concerned by this, least of all the people who are in charge. And make no mistake about this, point number two is that our elected representatives have zero political will to change the system that we all exist within now. Because insurance companies are making record profits, well, that means they're spending record amounts of money on legally bribing members of Congress through lobbying to make sure that nothing changes, that everything stays the same, that hospitals go broke while stock owners of healthcare companies get record dividend checks. Because at the end of the day, here in the United States of America, profits mean more than anything else, including your life or the life of people that you care about. So, to those of you in the medical care community who have walked off the job, who have left through burnout or lack of pay, I don't blame you one damn bit. And yeah, I am horribly freaked out that if I have to go to a hospital, I might not be able to get the care I need. And yet, I still don't blame you one goddamned bit, because at the end of the day, the medical and healthcare industry is like every other industry here in the US. It is dependent upon its labor force. And if those people are not being treated well, then they shouldn't be selling those people their labor. Unfortunately, when this arises in fast food, some people don't get their McMuffin quickly. But when it happens in the medical industry, people die. So everybody, I implore upon you, be as safe as you can out there. Take precautions and do whatever you can to not have to end up in one of these understaffed, overworked facilities that solely exist to make billions of dollars a year for health insurance companies. Until next time, my name is James. I am from the internet, and I am out. Peace.